Next up is Emily Jackson. Emily is going to be talking about depression and anxiety in children and youth, recognizing signs and symptoms when your child is struggling with mental health, and what to do when your child is struggling, and as well some mental health resources. So welcome, Emily.
Thank you, Barbara, and thank you, Calgary Youth Police Foundation, for putting on such a wonderful webinar today. My name is Emily. Hi, everybody. Welcome to the presentation today. I'm a registered social worker here in Calgary and a mental health therapist. In my private practice, I support young people and parents. I also have two children aged 12 and 13. So just like you, I'm living this experience too. My interest in children and youth mental health started during my clinical internship at the Alberta Children's Hospital in the mental health inpatient unit. And as Barbara mentioned, I'm going to talk to you today about depression and anxiety, the signs and symptoms, what you can do to help support your children, and where you can access help if your child is struggling. I'm just going to put my presentation on for you. Okay. So first off, signs of depression. These are the common signs of depression. Now, each and every child will show different signs and symptoms. So no two children show the exact same signs of depression. Some of the signs can include feelings of sadness, worthlessness, and hopelessness. Oftentimes, parents will notice a decrease in mood in their child. They may be feeling sad, they may have teary episodes. They may also express hopelessness and tell you moments of despair that they have. Another sign is decreased interest in activities and things that used to make your child happy. So for example, if your child loved to play guitar and you've noticed that they have absolutely no interest in strumming their guitar, or they don't want to play their guitar anymore, but this was an activity that they loved to do, this can be a sign of decreased mood. Another example could be if your child was on a hockey team and they've decided that they no longer want to go to practices and they no longer want to go to games. This can be another sign of depression or changes in your child's mood. Changes in eating habits. This can be seen through eating more or eating less. So oftentimes parents will see a dramatic increase in weight gain or dramatic weight loss. Changes in sleeping habits. So often this can be sleeping too much or too little at night. One other sign is frequent napping during the day. If your child gets into the car and you're driving to an activity and your child falls asleep and naps in the car, or if you have a teenager who has a spare in school and they go home to have a nap, this might also represent some changes in some low mood in your child. Not wanting to be around friends and family members, changes in energy levels. So this could be your child being more tired, more sluggish, but it can also be the opposite. So it could also be your child being restless, irritable, tense. We want to look for those dramatic changes in behavior or mood. Troubles concentrating and focusing. Specifically, we see this during school hours. So a child might have trouble concentrating on the lesson in class, or they might have trouble focusing on schoolwork. Parents will see oftentimes a dramatic decrease in their child's grades. And children might have a million excuses as to why they don't want to go to school. So that can be another sign or symptom that your child is struggling with their mood. Lastly, thoughts of death or suicide. This also includes self-harm and self-destructive behavior. Now, we know that children have days where they feel more sad than other days. Signs of depression become concerning when our child is showing days where they're more sad or having these signs and symptoms more often than days not. And usually, if a child is experiencing these signs for 2 weeks or more, or if these signs are impacting the child's daily life, so their ability to make friends, to keep friends, their ability to attend school or extracurricular activities, then then that's when we would be concerned with depression. The next slide is signs of anxiety. So as with depression, no two children present the same with the exact same symptoms of anxiety. Symptoms of anxiety usually present for a few months. So this is more of a long-term presentation. This isn't necessarily your kiddo who is an extra worrier and worries a little bit more than the typical child. This is excessive worrying for, a few months long. So oftentimes signs of anxiety include being afraid to be away from your parents, extreme fears about specific things and situations, being afraid to go to school or attend social events, being extra worried about the future or bad things happening to them. This can include signs of anxiety can be physical pains. So oftentimes our kiddos might say, Mom, Dad, I have a stomach ache or I have a headache. I can't go to school. Oftentimes physical pains are tummy aches, headaches, fatigue, nausea, vomiting. Those are all signs that our child might be anxious. Panic attacks are signs of anxiety as well. And poor concentration. This doesn't have to necessarily pertain specifically to school. This often is associated with our child having ruminating thoughts or spiraling thoughts or those racing thoughts. So if you have a child at home and you've said, can you please go pack your backpack? The bus is going to be here in 5 minutes, and your child just doesn't have the capacity to do that because they are fixated on the thoughts that are worrying them or the thoughts that they're ruminating on, that might be another sign that your child is struggling with anxiety. So, what to do when you think your child is struggling? I always encourage parents to talk to their children. I recommend avoiding the face-to-face conversations with your child. I don't encourage parents to actually sit down face-to-face with their child to have a conversation. Oftentimes, children don't feel comfortable doing that. It can be quite threatening for a child. So instead, I always encourage families to go for a walk, go for a drive in the car. You could also play a board game or a card game. That's a great time to have conversation, to ask your child how their day is, to just get some insight and information from your child. Remain as calm as you can. I know that this is extremely difficult, especially when our child expresses that they are struggling with their mental health. But it is really important to remain calm because our children feed off of our energy. So they need a safe and secure person to talk to. And, if that's not you, that is completely okay. But we can direct our children to a safe, calm, comfortable person where they can have a comfortable and safe conversation with a secure adult. So that could be a teacher, that could be a family member, that could be another adult friend. We really want to normalize mental health to our children. It is very normal for children, for youth, for adults to struggle with their mental health. As Barbara said, we really want to reduce the stigma that comes with mental health, and just having open and honest conversations with our kiddos around mental health will help reduce that stigma. When our children do come to us with mental health concerns or struggles that they're having, we really want to validate our child's experience. We can say things like, that sounds like it was a really hard day, or that was a really difficult experience. I can understand what you're feeling, or validating how they're feeling as opposed to fixing things. As parents, we always want to solve problems. We don't want to see our children hurt. We want to solve their problems. But it's really important to only fix things and solve problems when our child asks us to. So after validating our child's experience, we can say to them, would you like me to help? Or how can I support you? I always encourage parents to only give advice when advice is asked. One other thing I talk to parents about a lot is avoiding power struggles. We want to avoid power struggles with our kiddos. We also want to give our children choice and praise good behavior. Children will do well if they can. The next slide, these are 8 tips to help families thrive. And these 8 tips were developed by child psychologist, Dr. Bruce Perry. He developed these tips to help families stay regulated during times of stress and uncertainty, specifically during times of our global pandemic. So his number 1 tip is for families to have daily structure. So we know that children thrive when they're following routine. So we also know that children can tolerate stress when their home environment and their school environment is predictable and is routine. So when the world is so chaotic around our kiddos, especially during COVID, when our children are, sent home for online learning, and then they go back to the classroom and their extracurricular activities are canceled and they're wearing masks and they're not wearing masks. When the world is so chaotic around them, we know that children do best when their home environment has structure and routine. Again, I always encourage families to eat 1 meal a day together. This just allows you to connect, to communicate with one another. I encourage parents to ask questions like, what was your highlight of the day today? Or what did you struggle with today? Or what are you looking forward to in the following weeks? As opposed to asking that, how was your day question? That can be really huge and really daunting for lots of kids to answer that how was your day question. Limit media. I think we all know that we could probably reduce our time in front of screens. One thing that Dr. Perry really researched was the effects of violence and violent scenes on television, whether that's a television show or the news, on our children. And we know when children see scenes of violence, that increases the stress response in their body. So we really want to limit the violent scenes that children see. For example, we want to limit the exposure to COVID and the deaths related to COVID. We want to decrease exposure to the war in the Ukraine and to the school shootings. All of that exposure creates stress in our children. We also know that teens, and I would almost say that most adults, spend up to 5 to 8 hours on their social media devices or playing video games. So, we need to really reduce that. I always encourage families, turn the TVs off, turn the games off, go outside and get some fresh air, exercise, be out in nature. Exercise. speaking of that, exercise, we know that exercise is so good for our mental health. When we participate in physical activity, it decreases our stress, it increases our mood, it can decrease anxiety, and it also can decrease depression. Reaching out. So connecting with others is a very, very important way that we can reduce the stress that we have, and we can reduce burnout. So it's important for parents, please reach out. You know, taking care of, like as Liam said, taking care of your needs, taking care of your wellness, making sure that your bucket is full so that you can then care for the others around you is so important. You know, ways to fill your bucket are doing things that bring you joy. So, you know, being physically active, connecting with others, you know, doing art, listening to music, journaling, all of those things fill your bucket. So when your bucket is full, you can then help support your children or your other family members. Helping others. During difficult times, such as the pandemic, we know that it's important to help those in need. This can be simple acts of kindness, such as, you know, shoveling your neighbor's walk or picking up prescriptions for your aunt, for example. Little acts of kindness make us feel better when we help others. Sleep hygiene. This is a topic that we could spend a whole nother webinar on. I always touch on sleep hygiene in all of my counseling sessions. This is a really, really important topic to talk about as a family. One of the key things that I always encourage parents, you can start having good sleep hygiene by having a set bedtime and a very consistent bedtime routine. The other thing that we know is that it's important to reduce screen time at least a minimum of 1 hour before bedtime. Lastly, having a positive and future-focused conversations with our kiddos does help decrease their stress. Okay, this next slide. This slide is kind of the resource slide. So where to turn if you know your child is struggling with their mental health. I always encourage families to, if they think their child is struggling, they book an appointment with their family physician. And it's important to book an appointment where your child gets a physical exam and some blood work done, because we want to rule out any physiological reason why your child's mood or behaviors have changed. So, you know, by having a physical exam and blood work, we can rule that out. One thing to note is that many mental health clinicians cannot diagnose your child with a mental health disorder. If a family physician or a pediatrician, a psychiatrist, and some psychologists are the ones that do diagnose mental health conditions. A doctor or a psychiatrist are the only ones that can actually prescribe medication should your child need medication. So that's why it's so important to connect directly with your physicians so that you can have these conversations started should your child need further supports down the road. Access mental health. This is a non-urgent phone line that you can call. There is no referral needed to make this call. If you feel like your child is struggling with their mental health, you can call this phone this phone number, and you'll talk directly to a mental health clinician. This clinician assesses your child's needs, and they can refer you out to a program. So they know all of the programs within the Alberta Health Services and within the community. So all of those community-based programs such as Woods or Hull or Families Matter, all of these community programs, one of the Access Mental Health clinicians can make those referrals. Now, as we know right now, our medical system is really strained. So right now, the wait lists for some of these programs by Alberta Health Services are extremely long, and you can be waiting for up to 6 months, even more, to get into these programs. So there are supports that you can access in the time being. Kids Help Phone is a great support for your child. They can text, they can call, they can also online chat with somebody from the Kids Help Phone if they need support. The Distress Center, that's a great resource, not only for our teens and our young adults, but also for parents. Parents, if you are struggling, you can call or text the distress line, the Distress Center, and you will talk to somebody to help support you through the crisis that you are going through. 811, this is HealthLink. When you call 811, you will be directed to a registered nurse. They'll assess your child. They'll determine whether this is an urgent need where you need to take your child to the hospital, or whether this can wait and you should see a family physician, or if there's another outside resource that you can access. 811 will help direct you. As Liam mentioned in the previous set of slides, your school counselors and your school supports, that's a great resource for your children while they're at school and during school hours. As Liam mentioned, call your administrative team, call your school, your child's teacher, find out what supports are there for them at their school. Your place of worship, another great resource for you. Therapists, counselors, and psychologists. Many of us don't have wait lists, or many of us hold sessions aside for people who are in urgent need. So you can find a therapist, counselor, or psychologist. You can ask a friend, who do they see? Do they have any recommendations? Word of mouth is great. Your family physician should also be able to refer you to a therapist. There's also a great resource online. If you were to Google Psychology Today, it's actually a directory. Within that directory, you can put in your postal code, so you could find a therapist that is close to your home or that's close to your child's school. And I always encourage families to do a consult with a therapist, connect with them over the phone, and then determine whether you think this is a good fit for you and your child. If your child is at immediate risk of harming themselves or someone else, please take them to your local emergency department or to your urgent care clinic for a proper assessment. Feel free to screenshot or take a photo of this slide. Most of these resources you'll also find online if you Google them. But for just quick access, if you take a photo of this, then you'll have them. You'll have all the numbers right there on your phone, and you can share some of these numbers with your children and let them know that there are places that they can reach out to. I will also stick around for the Q&A, so if you have any questions, feel free to ask them then.
Thank you, Emily. That was incredibly informative, and your checklists, I think that they'll make a big difference in a lot of families' lives, just because having that kind of resource is really invaluable. And I really appreciated too how you spoke about we're not alone. You know, when your child is going through these things and you're seeing these lists and you recognize that your child is experiencing them, other children are too. And it is okay to talk to people about it and get that help that's needed. So
yes,
that was fantastic. And we'll definitely put in the future webinar slot sleep hygiene. So that's so fantastic.
Thank you.
Next question is, I have a friend whose child refuses to go to school, and yet the school actually asked his parents to seek diagnosis and therapy outside of the school board. They're seeing a psychologist privately to try to remedy the situation. However, the school refuses to help otherwise and simply indicates that he should go to school. It becomes a daily hassle to try to get the school to the school, and it is becoming really stressful. It also increases anxiety for my friend, as my friend already has had anxiety. Where can they go for help outside of their own school? Yes, the child is 13 years old in junior high.
Like they are seeking a psychologist privately. So whether that's assessment based or that's counseling, I would start there. I would continue going down that road. I think, you know, having the parents really communicate with the teacher, with the school, talking about what is working right now. These are the goals we're working on, and having maybe some set attainable goals for getting your child to school and figuring out, you know, I do have some clients that have different types of like re-entry to school plans. So maybe the goal of the day is that they attend, you know, 2 of their preferred classes. And then the rest of the classes, they go to whatever school supports program they have, whether that's the library or a guidance counselor. But they work with the school to make it so that their child is successful at school.
It's great advice. Thank you, Greta. Thank you. I'm glad that you're able to stick with us for a couple more minutes. The question here is, any books you can recommend on the subject that can help parents?
Okay, any books on the subject? Can you say that again, Barbara?
Yes, any books on the subject of youth mental health?
Oh, yes,
that
yes.
Recommend for parents.
One book that's very, very highly recommended is Parenting from the Inside Out by Dr. Siegel. That's a really wonderful one. There's also a really great book for kiddos. It's called, oh, I have it in my bag here. It's actually more of a comic book, and it's all about anxiety. I'm going to grab it. And I'm going to show you because it's fabulous. I want to say it's maybe called The Power of Anxiety. And it's a book directly for kids, but parents can read that book with their child. You know, Dr. Bruce Perry is a wonderful child psychologist. Anything from him is fabulous. There's so many great books out there.
Right.
Called Superpowered: Transform Anxiety into Courage, Confidence, and Resilience. This is the comic book. And it's like it's kind of got lots of pictures in it. It's a good book to read with your kids.
That's fantastic. Great resource. Thank you, Emily. So we're coming up at 10 minutes after. What I'm going to do is I will save all of the unanswered questions. And then when we send out the resources afterwards with the link to watch this recording, we will see if we can answer as many of them as possible there so that they are for everybody. So all of the attendees know you're going to receive an email with a survey in it where we will ask for your feedback on our webinars so that we can continue making these incredible webinars that are free for everybody to learn from. On behalf of the Calgary Police Youth Foundation, thank you to our presenters today. You have been inspirational and educational for all of us. We're so grateful to you all. Thank you. To everyone who attended today, thank you. I hope that you learned what you needed to learn. This will be, like I said, available as a resource for you to watch again and again. We will share that link with you in about a week. Thank you, everyone. Take good care. Stay well.